Hello everyone, we are here with another global health concern, and that is diabetes mellitus. We will make a detailed discussion with you regarding diabetes mellitus, including these questions. 1. What is diabetes mellitus? 2. What are the types of diabetes mellitus? 3. What are the causes of diabetes mellitus? 4. What are the symptoms of diabetes mellitus? 5. How is diabetes mellitus diagnosed? 6. How is diabetes mellitus managed? 7. What are the medications used for the treatment of diabetes mellitus? 8. How is diabetes mellitus prevented? 9. What are the risk factors or long-term complications of high blood sugar levels? Let's begin. What is diabetes mellitus? Diabetes mellitus refers to a group of diseases that affect how the body uses blood sugar or glucose. Glucose is vital for health because it's an important source of energy for the cells that make up the muscles and tissues. It's also the brain's main source of fuel. Diabetes occurs in one of these situations. The pancreas, which is an organ behind the stomach, produces little insulin or no insulin at all. Insulin is a naturally occurring hormone produced by the beta cells of the pancreas, which helps the body use sugar for energy. Or, the pancreas makes insulin, but the insulin made doesn't work as it should. This condition is called insulin resistance. What are the types of diabetes mellitus? Let's discuss. Prediabetes is when the blood sugar level is higher than it should be, but not high enough for the doctor to diagnose diabetes. They might call it impaired fasting glucose or impaired glucose tolerance. There are two main types of diabetes, type 1 and type 2. Type 1 diabetes occurs because the insulin-producing cells of the pancreas, that are beta cells, are damaged. In type 1 diabetes, the pancreas makes little or no insulin, so sugar can't get into the body's cells for use as energy. People with type 1 diabetes must use insulin injections to control their blood glucose. Type 1 is the most common form of diabetes in people who are under age 30, but it can occur at any age. 10% of people with diabetes are diagnosed with type 1. Next one is type 2 diabetes, or adult-onset diabetes. In this type of diabetes, the pancreas makes insulin, but it either doesn't produce enough, or the insulin doesn't work properly. 9 out of 10 people with diabetes have type 2. This type occurs most often in people who are over 40 years old, but can occur even in childhood if there are risk factors present. People with type 2 diabetes almost always had prediabetes first. Type 2 diabetes may sometimes be controlled with a combination of diet, weight management, and exercise. However, treatment also may include oral glucose-lowering medications taken by mouth, or insulin injections or shots. Other types of diabetes might result from pregnancy, that is gestational diabetes, surgery, use of certain medicines, various illnesses, and other specific causes. What is gestational diabetes? Let's learn. Gestational diabetes occurs when there is a high blood glucose level during pregnancy. As pregnancy progresses, the developing baby has a greater need for glucose. Hormone changes during pregnancy also affect the action of insulin, which brings about high blood glucose levels. Pregnant women who have a greater risk of developing gestational diabetes include those who are over 35 years old, are overweight, have a family history of diabetes, have a history of polycystic ovary syndrome or PCOS. Blood glucose levels usually return to normal after childbirth. However, women who have had gestational diabetes have an increased risk of developing type 2 diabetes later in life. What are the causes of diabetes mellitus? The causes of diabetes are not known. These risk factors may increase the chance of getting diabetes. Family history of diabetes, or a personal history of gestational diabetes. African American, Hispanic, Native American, or Asian American race, Pacific Islander, or ethnic background. Injury to the pancreas, such as infection, tumor, surgery, or accident. Autoimmune disease. Age, risk increases with age. Physical stress, such as surgery or illness. There are risk factors that one might have more control over, including high blood pressure, abnormal blood cholesterol or triglyceride levels, smoking, being overweight, use of certain medications, including steroids. It is important to note that sugar itself doesn't cause diabetes. Eating a lot of sugar can lead to tooth decay, but it doesn't cause diabetes. What are the symptoms of diabetes mellitus? The symptoms of diabetes include increased thirst, increased hunger, especially after eating, dry mouth, frequent urination, unexplained weight loss, even though you are eating, and feel hungry. Other symptoms include weak, tired feeling, blurred vision, numbness or tingling in the hands or feet, slow healing sores or cuts, dry and itchy skin, frequent yeast infections or urinary tract infections. What are the symptoms of low blood sugar? Let's learn. Most people have symptoms of low blood sugar or hypoglycemia when their blood sugar is less than 70 milligrams per deciliter. Healthcare provider can tell the patient how to test the blood sugar level. When the blood sugar is low, the body gives out signs that the person needs food. Different people have different symptoms. One can learn to know his or her symptoms. Common early symptoms of low blood sugar include feeling weak or dizzy, including trembling and feeling shaky, feeling hungry, sweating, pounding heart, pale skin, feeling frightened or anxious. Late symptoms of low blood sugar include feeling confused or being able to keep your mind on one subject, headache, poor coordination, bad dreams or nightmares, feeling cranky, numbness in mouth and tongue. How is diabetes mellitus diagnosed? Diabetes is diagnosed with fasting sugar blood tests or with A1C blood tests, also known as glycated hemoglobin tests. A fasting blood sugar test is performed after the person have had nothing to eat or drink for at least 8 hours. Normal fasting blood sugar is less than 100 milligrams per deciliter or 5.6 millimole per liter. One does not have to be fasting for an A1C blood test. Diabetes is diagnosed by one of these. The blood sugar level is equal to or greater than 126 milligrams per deciliter or 7 millimole per liter. One has 2 random blood sugar tests over 200 milligrams per deciliter or 11.1 millimole per liter with symptoms. One has an oral glucose tolerance test with results over 200 milligrams per deciliter or 11.1 millimole per liter. The A1C test is greater than 6.5% on 2 separate days. An A1C test should be performed in a laboratory using a method that is certified by the National Glycohemoglobin Standardization Program or NGSP and standardized to the Diabetes Control and Complications Trial or DCCT-SA. How is diabetes mellitus managed? There is no cure for diabetes, but it can be treated and controlled. The goals of managing diabetes are to keep the blood glucose levels as near to normal as possible by balancing food intake with medication and activity. Maintain the blood cholesterol and triglyceride or lipid levels as near the normal ranges as possible. Control blood pressure. The blood pressure should not go over 140/90. Decrease or possibly prevent the development of diabetes-related health problems. One holds the keys to manage diabetes by planning what to eat, and following a balanced meal plan. Exercising regularly. Taking medication, if prescribed, and closely following the guidelines on how and when to take it. Monitoring blood glucose and blood pressure levels at home. Keeping appointments with healthcare providers, and having laboratory tests completed as ordered by the doctor. What one does at home every day affects the blood glucose more than what the doctor can do every few months during the checkup. What are insulin pumps? Insulin pumps are small, computerized devices, about the size of a small cell phone, that one wear on his or her belt, in his or her pocket, or under his or her clothes. They deliver rapid-acting insulin 24 hours a day, through a small flexible tube called a cannula. The cannula is inserted under the skin using a needle. The needle is then removed, leaving only the flexible tube under the skin. The pump user replaces the cannula every 2 to 3 days. An insulin pump can deliver insulin 24 hours a day. It is important for pump users to frequently monitor their glucose levels, either with a continuous glucose monitor or a finger stick monitor. The pump delivers a continuous flow of insulin that can be adjusted, if needed, for things like exercise and stress. A pump user regularly enters information about their food intake and blood sugar levels into the pump, so it can help them calculate insulin doses for food intake and high blood sugar levels. Benefits of an insulin pump include fewer insulin injections, a more flexible lifestyle, and a more consistent and adjustable delivery of insulin. Can both pills and insulin be taken together to control blood sugar? Yes. The combination of insulin and an oral medication, when taken as directed by the healthcare provider, is very safe and effective in controlling blood sugar. A typical combination therapy consists of taking an oral medication during the day and insulin at night. Once a person begins taking insulin, he or she will need to monitor the blood sugar more often to reduce the risk of low blood sugar reactions. Combination therapies are often helpful for people who have type 2 diabetes. If one has been taking an oral medication, doctor may change the treatment plan to include insulin injections. This change is often made to help people with type 2 diabetes gain better control of their blood sugar. What are the medications used for the treatment of diabetes mellitus? Anti-diabetic agents include all the different types of medicine involved in the treatment of diabetes. All these agents reduce blood sugar levels to an acceptable range, also known as normoglycemia, and relieve symptoms of diabetes, such as thirst, excessive urination, and ketoacidosis. These agents also prevent the development of, or slow the progression of, long-term complications of the disease, such as nephropathy or kidney disease, neuropathy or nerve damage, and retinopathy or damage to the retina of the eye. Common anti-diabetic medications include insulin. It incorporates insulin aspart, insulin betamir, insulin glargine, insulin glulisine, insulin lispro, NPH insulin suspension, and regular insulin. Amylin analog. It encompasses pramlintide. Oral agents. These include acarbose, glipizide, glimepiride, gliburide, metformin, miglitol, nataglinide, pioglitazone, ripaglinide, rosiglitazone, sitagliptin, and tolbutamide. Incretin mimetic agents. These incorporate exenatide. Let's discuss each of them in detail. First one is insulin preparations. These include rapid-acting and short-acting insulin preparations. 4 insulin fall into this category, which are insulin lispro, insulin aspart, insulin glulisine, and regular insulin. Intermediate-acting insulin. Neutral protamine hagedorn, or NPH insulin, is a suspension of crystalline zinc insulin, combined at neutral pH with a positively charged polypeptide, protamine. Another name for this preparation is insulin isophane. Its duration of action is intermediate. This is due to delayed absorption of insulin because of its conjugation with protamine, forming a less soluble complex. Long-acting insulin preparations. These contain insulin glargine and insulin betamir. Various premixed combinations of human insulins, such as 70% NPH insulin, plus 30% regular insulin, 50% of each of these, or 75% NPL insulin, plus 25% insulin lispro, are also available. Next is synthetic amylin analog. Pramlintide is a synthetic amylin analog that is indicated as an adjunct to mealtime insulin therapy in patients with type 1 or type 2 diabetes. Insulin secretagogues are the agents that are useful in the treatment of patients who have type 2 diabetes, but who cannot be managed by diet alone. The patient most likely to respond well to oral hypoglycemic agents is one who develops diabetes after age 40 and has had diabetes less than 5 years. Patients with long-standing disease may require a combination of hypoglycemic drugs, with or without insulin, to control their hyperglycemia. Insulin is added because of the progressive decline in beta cells that occurred due to the disease or aging. Oral hypoglycemic shouldn't be given to patients with type 1 diabetes. Insulin secretagogues incorporate sulfonylureas. These are classified as insulin secretagogues because they promote release of insulin from the beta cells of pancreas. The primary drugs used today are tolbutamide and the second-generation derivatives, glyburide, glipizide, and glimepiride. Meglitinide analogs. This class of agents includes ripaglinide and nataglinide. Although they are not sulfonylureas, but they have common actions. Insulin sensitizers. Two classes of oral agents are, including in insulin sensitizers, which are biguanides or metformin, and thiazolidinedionase or glizones, including pioglitazone and rosiglitazone. They improve the insulin action. These agents lower blood sugar by improving target cell response to insulin, without increasing pancreatic insulin secretion. Alpha-glucosidase inhibitors. Acarbose and miglitol are orally active drugs used for the treatment of patients with type 2 diabetes. Dipeptidyl peptidase 4 inhibitors. Sitagliptin is the only drug in this class that has been used to treat type 2 diabetes. Next are incretin mimetics. These oral glucose agents results in a higher secretion of insulin that occurs when an equal load of glucose is given intravenously. This effect is referred to as the incretin effect and is apparently reduced in type 2 diabetes. Exenatide is the drug in this class that does not only improves glucose-dependent insulin secretion, but also slows gastric emptying time, decreases food intake, decreases postprandial glucagon secretion, and promotes beta cell proliferation. Consequently, weight gain and postprandial hyperglycemia are reduced, and HbA1c levels are declined. Being a polypeptide, exenatide must be administered subcutaneously. How is diabetes mellitus prevented? Although diabetes risk factors, like family history, cannot be changed, there are other risk factors that you do have some control over. Implementing some of the healthy lifestyle habits below can improve these modifiable risk factors and help to decrease the chances of getting type 2 diabetes. Eating healthfully. Being physically active. Lowering your stress, limiting alcohol intake. Getting enough sleep and quitting smoking. What are the risk factors or long-term complications of high blood sugar levels? Let's learn. Retinopathy or eye disease. All patients with diabetes should see an ophthalmologist or eye specialist every year for a dilated eye examination. Patients with known eye disease or symptoms of blurred vision in one eye, or who have blind spots, may need to see their ophthalmologist more often. Nephropathy or kidney disease. Urine testing should be performed every year. Regular blood pressure checks are also important because management of high blood pressure is essential in slowing kidney disease. The blood pressure should be checked at every visit with the healthcare provider. The American Diabetes Association recommends keeping blood pressure below 140 by 90 mm of mercury for most adults. Persistent swelling in the leg or feet also may be a symptom of kidney disease and should be reported to the doctor. Neuropathy or nerve disease. Numbness or tingling in the feet should be reported to the doctor at regular visits. Check the feet every day for redness, calluses, cracks, or breakdown in the skin tissue. If one notices these symptoms before the scheduled visits, notify the doctor immediately. Other long-term complications may include other eye problems, including glaucoma and cataracts, dental problems, high blood pressure, heart attacks and strokes, and sexual health problems. We really hope that, from this video, you people have gained lots of information regarding diabetes. We will be looking forward for your feedback, so that hopefully, we could be able to provide you such informative contents in future as well. And it would be great if you suggest us that which healthcare topics you want us to cover further. Thank you.